Hello and welcome to my channel. And this lecture we're going to discuss the back. So let's begin. The back muscles divided into three groups: superficial, middle, and deep group. And the deep group is subdivided into three groups. So we'll just mention them. We will not study in detail because the back has no clinical significance, in either in exams, multiple choice, or in medicine, because the muscles are segmentally supplied by dorsal rami of nerves. So the muscle receives multiple nerve supply. So you can never get a lesion in the back muscle unless the injury is very bad and endangering the patient's life. So that's why there are no stresses that much on the back. But anyway, the superficial group is the group of muscles that connect the upper limb to the vertebral column, like the trapezius muscle, like the latissimus dorsi muscle, the rhomboids major and minor muscles, and the levator scapulae muscle. All these represent the superficial group of the muscles of the back. The middle group is two muscles, serratus posterior superior and serratus posterior inferior. The serratus posterior superior takes from the lower cervical and the upper thoracic and descends downwards and lateral to the angles of the ribs to be inserted in the upper ribs. And the serratus posterior inferior arises from the supraspinous ligament and the fascia, and also ascends upward and lateral to be attached to the ribs, outer surface of ribs, lateral to the angles. Now, from the direction of fibers of the serratus posterior superior, it shows that it elevates the ribs, so it's active in inspiration, while the serratus posterior inferior pulls the ribs down, so it's active in expiration. Actually, it's forced inspiration and forced expiration. And the nerve supply of the serratus posterior superior by the ventral rami, remember this, ventral rami, not dorsal rami like the rest of the back, of T2 to T5 segments, intercostal nerves, and the nerve supply of the serratus posterior inferior by ventral rami of lower four spinal nerves, the intercostals. So remember this trick about the middle group, that it's supplied by the ventral rami, not the dorsal rami. The deep group, called the intrinsic muscles, is subdivided into three groups. Those who extend and rotate the head and neck, like the splenius capitis and cervices, they are called the spinotransversalis muscles. Extensors and rotators of the vertebral column, like the erector spinae muscle and the transversospinalis muscles. The names are a little bit confusing, but you have to learn it this way. Erector spinae and transversospinalis, the short segmental muscles between the spines and between the transverse processes, like the interspinalis and the intertransversarii muscles. Okay, the spinotransversalis muscles, the splenius, capitis, and cervices. The splenius capitis, as you can see here, from the ligamentum nuchae upward and laterally to the occipital bone and the mastoid process, while the splenius cervices from the ligamentum nuchae and spinous processes upward to the transverse processes of upper cervical vertebrae. Both muscles draw the head back and extend the neck, and they individually on one side rotate the head to one side, to their side. Okay, so extension and rotation of the head. Of course, you know the rotation, where does it occur? In which joint? The atlantoaxial joint, exactly between the axis and the atlas. The erector spinae group, it has three components. The iliocostalis, the lateral component, as you can see here. Longissimus is the middle component. The spinalis is the medial component. again, iliocostalis, longissimus, spinalis, they all arise from the fascia and spinal supraspinous ligament, as you can see here. Deep to it is the multifidus muscle, part of the deep muscles of the back. The transversus spinalis group, which is the semispinalis, you can see part of it here, the semispinalis. The multifidus, it's all buried down here, multifidus muscle, and rotators on the lateral sides of the spines, rotator lumborum, thoracic cervicis. They're all names of the muscles in their regions, and they all segmentally supplied by the dorsal rami of the spinal nerves. Of course, there are muscles between the spines and transverse processes, pardon me, and attached to the posterior surface of the ribs, like the levator costorum, the interspinalis, and the intertransversi. Remember, we studied the suboccipital triangle in the neck. We studied it in detail. Anyway, it's part of the deep muscles of the back. Okay, so remember, the lateral side is the iliocostalis, the medial is the spinalis, and the middle is the longissimus muscle, as you can see here. Now, the vertebral column shows, as I told you before, shows two types of curvatures. The two secondary curvatures in the cervical region and the lumbar region, because they are acquired curvatures. The primary curvatures, the one that that existed in fetal life, like the thoracic curvature and the sacral curvature. These are the primary curvatures, and I recall we talked about lower doses in which the curvature or the lumbar curvature is exaggerated due to any pathology, or like in pregnancy, for example. This is a case called lordosis, while the vertebra or the spine going from side to side in an abnormal curvature, this is called scoliosis. So we have scoliosis, we have lordosis, and remember we talked about the spondylosis, in which there's narrowing of the intervertebral foramen because of compression of vertebrae, for any pathology in the ligaments between them. And this will lead, especially in the cervical region, to compression of the artery inside the vertebra, which is the vertebral artery. These are called the transient ischemic attacks. Transient ischemic attacks due to pressure on the vessels in the vertebra leads to decreased blood supply going to the brain. Now, for the venous drainage of the vertebral column, we have plexuses. We have an external plexus formed of anterior part and posterior parts, posterior to lamina, as you can see here. And it's connected to an internal vertebral venous plexus that's present in the epidural space. Epidural space, remember the one we talked about? The epidural space contains the intervertebral venous plexus. Well, it's defined as two anterior and two posterior venous columns connected within the vertebral canal, and they receive also the basiovertebral veins, which are the veins coming out of the bodies of vertebra that drains the vertebral column itself. So we have an external vertebral venous plexus that has anterior component and two posterior components, as you can see here, connected to the internal vertebral venous plexus, which is outside the dura in the epidural space in the vertebral canal, and they are both connected through the intervertebral foramen. Don't forget this. This is essential for the spread of metastasis. I told you both internal and external are connected, and so any metastasis can wander between vertebral veins, posterior intercostal veins, lumbar veins, and this is why Cancer prostate, for example, famous of metastasizing to the vertebral column through its connection with the external vertebral venous plexus with the prostatic venous plexus. The venous plexus of the spinal cord are tortuous veins on the front and back of the spinal cord. It's in the pale layer, the pale mater layer, and it's also connected with the internal and thus the external vertebral venous plexus along communicating nerves that communicating veins that drain the spinal nerve. The spinal cord itself, it shows a cervical enlargement. We'll not talk pretty much details about the spinal cord, but just a hint about its external features. It has cervical enlargement for the supply of the upper limb, the brachial plexus. It has lumbosacral enlargement for the supply nerves going to the lower limbs. See the end of the spinal cord. This is the end of the spinal cord called the conus medullaris. It's present between L1 and L2 vertebrae, and in children it's a little lower down in newlyborns and young children. It's at level of L3. So this to remind you, if you want to go to the lumbar cistern, go below L3 in a child, so as not to damage the end of the spinal cord, which is the conus medullaris. All what we have here in the rest of this space is cauda equina, the nerve roots of the lumbosacral plexus. The spinal cord segment is the area of the spinal cord that gives rise to a pair of nerves, spinal nerves. This is the right side and the left side. By dorsal and ventral roots, they both unite at the intervertebral foramen. Don't forget the dorsal root ganglion at the dorsal root. It's the path for the sensory pathways coming from the body. And don't forget the gray rami communicantis and white rami communicantis. White rami communicantis bringing the outflow of sympathetic. Gray rami communicantis takes it from the sympathetic chain to distribute it with the nerve. Don't forget these facts. The spinal cord itself has an anterior median fissure and a posterior median sulcus. The fissure is deeper than the sulcus. For different cut sections of the spinal cord we studied before, this is the cervical region in which the ventral horn shows shelving, as you can see here. This is the thoracic with its lateral horn for the sympathetic outflow. This is the lumbar cut section, and this is sacral cut section with the lateral horn for the parasympathetic outflow from the spinal cord. Remember, the lateral horn in the thoracic region, thoracic and upper two, for the sympathetic outflow, and that in the sacral region is for parasympathetic outflow. The vertebral levels of the spinal cord segments, because the spinal cord is much shorter than the vertebral column, so in cervical region, if you have in a certain vertebral spine, add 1 plus 1 to detect the segment. In the thoracic region, add 2. In the lower thoracic, add plus 3. For example, if you are at a level of the 9th thoracic vertebra, so you are at the level of the 12th thoracic segment. T11 is at L3 segment, and T12 vertebra is at S1 segment. And remember, the conus medullaris was between vertebra L1 and L2. The coverings of the spinal cord, beginning from the dura mater, continuation of the fibrous dura of inside the skull, and it ends at the subdural space in S2 level, and it has tubular sleeve prolongations around the spinal nerves together with the arachnoid, so the CSF goes slightly, outside the vertebral canal through the intervertebral foramen. And then the dura, merges with the epineurum of the nerve afterwards. There is an epidural space which has connective tissue in it and the internal vertebral venous plexus. and subdural space, which is a potential space filled with film of serous fluid, and then comes the arachnoid, which lines the dura and goes with it till the level of S2. Remember that. And here in this region of the spinal cord, it's only the roots of the nerves C, because they are almost vertical. This is the lumbar cistern that's filled of a collection of CSF that you can have access to below the level of L1 and L2 vertebra. This is called the lumbar cistern. Now the pia mater itself forms the ligamentum denticulatum on the lateral side, see that? Between the spinal nerves, and we saw a myelogram before in which, you know, the dentations in the myelogram referred to the CSF sleeves around the spinal nerves, because the dura and arachnoid go out with the spinal nerve. But at real life, this dentate structure is the ligamentum denticulatum between these spinal nerves, as you can see here, because it fixes the spinal cord in the central position by attaching it laterally to the dura mater, and the spinal cord itself is attached superiorly to the medulla and inferior to the back of coccyx by the filum terminale, which is the other structure formed by the pia mater. See that? There's the conus medullaris. See that? This single structure. See that in the middle? This is the filum terminale. The filum terminale pierces the dura and arachnoid and extends outwards to attaches to the back of coccyx. The inside part is called filum terminale internum, and the outside filum terminale externum. These are structures formed by the pia mater. The blood supply of the spinal cord, remember that we talked about the spinal arteries that divide into radicular arteries to supply the different regions of the spinal cord, and that the anterior spinal arteries united into one, while the posterior spinal arteries remained in two on the posterolateral part of the spinal cord, and the venous drainage of the spinal cord by the tortuous veins at front and back, and gives also radicular veins that drains the spinal nerves and the spinal cord to the vertebral venous plexuses. This concludes the study of the back, and so the abdomen, although we finished the abdomen the last time. I hope you got the maximum benefit from this lecture, and thank you very much for watching.